Hey, everybody, and welcome to the MMOA podcast brought to you by the Institute of Clinical Excellence. My name is Csepe. I'm a doctor of physical therapy, and tonight we're going to be talking about a really important thing near and dear to my heart. We're going to talk about 3 things that you've got to do for your patients who are on GLP-1 medications. So, we've all, whether or not we know it, we've all been treating patients on Ozempic, Wegovy, tirzepatide, and I've had so many senior patients come to me, and outside of their referring provider, I'm the first one that they've shared. I'm the first one that knows outside of the doctor who prescribes that medication that they're on this new medication. And I really want you to be equipped with 3 different things and how to address when patients are taking these medications. Because patients might not know how to really maximize utilizing this medication for their health. They might not know any risks. And they might feel a little uneasy even how to proceed and what it's doing for their health. So let me share with you the 3 things you've got to do for your patients. Number 1 is be a cheerleader. And I know you might be thinking, well, I don't actually think that these medications are good for patients, especially seniors who might be at risk of losing their muscle mass. Friend, I want to just stop you right there and remind you that our biology fights to regain weight that's been lost, first and foremost. We have the built-in biology. If we have pneumonia, our body knows pneumonia is a problem. I have the built-in response, the defense mechanism to pneumonia. If my bone is broken, I have the built-in defense mechanism to address that problem. If I'm bleeding, I know how to handle this. Our bodies do not know how to handle obesity. Our bodies don't know that it's a threat. Metabolically, when we gain weight and then lose it, that's where our body is the problem, because over the millennia that we've been a species, our bodies don't know that weight gain can be problematic because we've only ever faced starvation. This is kind of a new thing that we're facing problems due to excess weight. So, what does that mean? Biologically, we're struggling to lose weight once it's been gained. What does that mean for our patient care? When we realize that fact, that it's really freaking hard to lose weight once it's been gained, it opens up a new lens to how we treat our patients. We treat them with understanding that this is a hard journey and that obesity can come with significant health consequences, and that this medication and this choice can be huge for their disease management, for their confidence, for their lifespan. So, even though you might say, I have some reservations as a clinician with who's getting these meds, whether or not they need it, if this person is appropriate to be managed medically, if there's going to be side effects and complications, I got to sprinkle this in that when your patient trusts you with the information that they're taking a drug and sharing with you, that they're apprehensive about how it's going to impact their health, we've got to be cheerleaders. We've got to say, wow, I love treating patients in your shoes. I'm so excited that I know that now because now I can help you even more. Man, your journey must have included a lot of different steps for you to get to this point. I'd love to hear about it. I'm sure that managing your weight with this medication finally feels like a success instead of constantly hitting your head into the wall and looking potentially in the mirror and feeling really frustrated with what you see. So I know that as healthcare providers, there's a catch-22 with this medication, but when a patient shares with you that they're starting this new medication, the last thing that we need to do is look down the end of our nose and say, good to know. Where are you getting it? How are you getting it? They don't need us to be judgmental, especially at the first breath of understanding this medication use. So, number 1 tool, you got to be a cheerleader and get stoked and get pumped for this changing tide. Side note, obesity rates are going down in America for the first time in decades. Why? Likely because of this drug. if we've been frustrated as a healthcare society with, wow, obesity rates are continually rising, where is the wave of crowds cheering that this medication is finally helping our population get success in this chronic health crisis? So I don't know. That's where I want to start here, is that we've got to cheer. Number two, if we're not uniquely poised as a profession to help these patients more than anybody else, other than the provider that's prescribing the med, I don't know who else is. So as healthcare providers, as exercise physiologists, OTs, PTs, we all have a unique role to play. And if you're a PT like me, I want to light a fire under your butt and light it hot, because the goal of number two of things that we have to do for this patient population is get them strength training. We have to help them maintain their muscle mass. I had a patient in the clinic the other day, after telling me that he's taking this GLP-1 medication to manage his weight and his diabetes. I said, wow, this is exciting. I know I'm seeing you for a spine fracture. And I imagine being kind of inactive and being on this medication, you're wondering if muscle mass is in the crosshairs of losing weight, and if you're potentially at a higher risk of losing muscle mass. And he said, oh no, my doctor told me that this medicine only makes me lose fat. Like, number one, I know that there's probably some miscommunication there, that his doctor never told him that it only makes him lose fat. But the fact that he's taking a drug as a 70-something-year-old guy who just had a spinal fracture, and he doesn't know that he's like a lobster in boiling water. He's in danger of losing his muscle mass, and he has no idea. And I have to be really proactive, team, to really light a fire under our butts as a profession, because it's really easy to look at somebody and say, well, so you just had back surgery. You want a back massage? Okay, maybe we can do some balance training. Yeah, that sounds safe. I have this guy deadlifting heavy in the clinic, because not only is it safe post-operatively for him to be lifting weight, but weight training is the only thing that's going to signal to his body to keep his muscles around. Nothing like strength training is going to signal to his body that, hey, I'm using these muscles. They can't go anywhere. And if he's losing weight, obviously some of his weight loss is going to come from muscle mass while he's on this drug. But if I instruct him as a skilled clinician using tools that I know, we can make some serious headway in keeping muscle on his frame. And some referring physicians who send their patients to our team send them with this Csepe scan, which is kind of like a bone mineral density or a DEXA scan, but it looks at muscle mass in specific limbs. And after we've been doing strength training with patients, we can see how much of his muscle mass has been preserved compared to those who aren't doing strength training and are losing their muscle mass at a higher rate because they're losing weight. So, number one, got to be a pep brigade, got to be a cheerleader. Number two, we've got to feel very, very comfortable with a global strength training program for each patient that's safe and powerful enough to keep their muscles around. Number three, we've got to be hyping protein. So if you're well-versed in understanding these medications, you know that some of the side effects include gastroparesis or slowed gastric emptying, some nausea, some potential bloating, but those side effects could not necessarily inspire people to want to make choices that fuel their muscles to stay around. I want to be really specific on why protein is so important. And I heard it, to be honest, on an Instagram reel from another physician. We don't have a way to store protein other than in our muscles. So if our body is in a protein deficit, it's not like our liver can just give us some more. It comes from our muscles when we're losing weight. We have an ability to use fat and burn fat for our nutrient needs. And we can use the glucose in our body and in our bloodstream to fuel what's going on for short periods of time. But when we need protein, it either needs to be on our plate or it's coming from our muscles. Our patients who are in a weight loss journey might not necessarily feel inspired to get a lot of protein. And it's our job and our responsibility as clinicians to really emphasize that as you're strength training, your protein intake has to match that muscle maintenance, especially as you're losing fat. So we need to make sure that we're advocating to our patients exactly how much protein they should get. When I'm working with seniors, they have honestly no clue how much protein they need. And they've seen all the king's horses and all the king's men. And very, very rarely, I would guesstimate that maybe 10% of my patients have heard from their physicians an exact number of exact amount of grams of protein that they need in their day to maintain their muscle mass. So it's our job, and it's totally within our scope of practice to advocate for the nutrients necessary to support physical function and maintain muscle mass in a calorie deficit. So it's our job. And if you're not super familiar with those amounts of protein, it's about, for a senior person, it's about 1.2 to 1.5 grams per kilogram of ideal body weight. That's going to take some focus. I'll just take the mental math out of there right now. It's going to take focus. It's going to take a game plan, especially if your patient in front of you feels queasy. It doesn't feel good after their injection days. They're not going to be inspired to really make the most protein-rich choices on their plate. So it's our job to make sure that that comes to fruition. So just to wrap it up, team, you're seeing patients on GLP-1 meds. You might not know it, but it's a good thing to ask because you can be so impactful in our patients' journey as they manage their weight in the long run. So those 3 things that you've got to do for your patients. Number 1, be a cheerleader. These people, many of my patients have suffered significant obesity bias in their healthcare journey, and they've felt healthcare members look at them for being lazy, undisciplined, unmotivated, and they finally have a solution. And it is so important for us as providers to be in their corner cheering. Number 2, we've got to have patients do appropriate strength training to signal to their muscles to stick around as they're in a calorie deficit. And number 3, we have to make sure that we're supporting those muscles with protein. So thank you so much for joining me in this podcast. Don't forget to subscribe wherever you listen to podcasts, and we'll look forward to seeing you guys next time.